So the integrative medicine program here at Hartford has been around for almost 20 years now. We offer a wide variety of integrative therapies, including yoga.
So complementary and integrative medicine is still viewed as fringe. It's still viewed as, unverified.
There's always been a bit of resistance by people who don't feel that it's true science or that it's more pseudoscience.
I had a colleague in the not too distant past actually say to me that he felt that this was witchcraft.
We live in two different worlds. We live in the world of mainstream insurance-driven medicine, and mainstream culture is very much determined by the pharmacological industry of let's beat the body into submission. If you feel bad, take your pills. Don't take drugs, but take your pills. And you have this whole so-called alternative world where people actually take care of their bodies.
We don't really have to educate our patients and our clients. They know that these integrative modalities work. They are the ones, I believe, who are driving the bus.
Our research shows that yoga is more effective for PTSD than any drug that any of us had ever studied. And I did some very serious studies on drugs for PTSD. Not much to my surprise, when our articles started to come out, I didn't see a single psychopharm clinic converted into a yoga studio.
This is one of the problems with scientists. Scientists are supposed to be open-minded, but by the same time, scientists have certain paradigms and they have certain belief systems. And when you come up with something that is novel, at first it's met with skepticism, and it's no different here.
As a traditional allopathic physician, I was trained in acute traumatic disease treatment, but the treatment options are somewhat limited when you talk about chronic diseases.
If yoga can produce the same benefits as a drug with less cost, and yoga has, if anything, positive side effects, then you now have a comparison that allows you to make an economic decision to say, yeah, we could give them a drug for their insomnia, but yoga works just as well.
The profits are in drugs. You make a hell of a lot more money paying psychopharmacologists, you pay yoga teachers.
Patients are getting more and more frustrated. They don't want to take a lot of medications. They don't like the side effects. They don't like the cost of drugs. And so many of them are going out on their own looking for alternative therapies.
You cannot win. You cannot treat an epidemic of type 2 diabetes, which is driven by poor lifestyle behaviors. You can't win by giving a pill. And yet that is the wet dream of most biomedical research scientists.
The science news that people read is most of all, we have found this new pill to make your problems go away.
They go to bed dreaming of the pill that will cure cancer, the pill that will cure type 2 diabetes. You can't just take the pill and continue with the negative behaviors. It doesn't make any sense. The system will crack somewhere else.
After our yoga studies came out, I don't think any major news organization called me up and said, this is major news. We can change the way we feel by practicing yoga, because it would really put responsibility back on oneself. That we can control about our lives and we don't have to go to doctors. And so it would decrease the power of the medical profession by actually doing that.
If indeed the results show a benefit, I think that everyone will ultimately adopt some sort of integrative medicine strategy.
When integrative modalities and conventional allopathic modalities come together, that is truly the best that medicine has to offer.